Thank you, everyone. I would like to acknowledge that this research that we did at Flinders University in Adelaide was funded by the Augusta Zadoff Award, which was supported through Safe Work SA, the concept being to improve women's health and safety at work. But the relevance in this context is on avoiding any aggressive incidents at work for the client and getting better understanding of the staff in how to do that. So the issue is that there are increasing aggressive events in the aged care workforce. We have a cohort of paid carers, currently around about 250,000, and projected by 2050 to be nearly 1 million staff. And that doesn't take into consideration the volunteer workforce. So the aged care environment, as we know, is both residential and community. And understanding and responding to older adults with cognitive decline requires excellent interpersonal skills. It requires understanding of the behaviours that are being presented, and it's about understanding how to respond to those behaviours. From an ageing Australian's point of view, there are many in residential aged care who have some form of dementia or present with some of the behaviours and symptoms of dementia. We know that these behaviours commonly include agitation, and we also know that agitation often escalates to aggressive events. 50% of adults diagnosed with dementia also have a mental health diagnosis. And when we look at the incidence of agitation that can increase to aggression, then it's often compounded by these other mental health issues. When we look at the aged care workforce, it's an interesting group of workers, 87% of whom are female, the majority of whom have a certificate 2, 3 or 4 in aged care or equivalent. They are asked and expected to work in isolated work conditions, often in confined places, and usually doing some sort of very personal care. The two graphs up here look at the ratios of staff born in Australia and born overseas. And the blue is born in Australia. The red, the smaller proportion, is overseas born but speaking English. And that green proportion, 22% in the residential aged care arena, don't have English as their first language. When we look in the comparison for the community, it's similar proportions but 14%. If we come back to that very original concept that understanding and responding to agitation requires really good interpersonal communication, and we have some language difficulties in the first place, then that's something that we need to look at and try and address. Sorry. This graph is now looking at the non-English speaking background of the countries of birth of the residents or members of the community. So on the left we have the residents in aged care. The majority groups, the biggest group, single group, is from Italy at the bottom, 19%. Multiple other groups. This is across Australia. When we look at the relative different countries of birth of the personal carers, it's a completely different cohort of countries. So whilst, yes, there are a number that are born overseas, the countries that these are born in don't match up. And so there is a primary problem with communication before we even come into the arena of dementia and behaviours associated. So the aim of this program was to improve the ability of female aged care workers to identify triggers and apply strategies to avoid and manage aggressive behaviour. It was a pilot study. As I said, it was funded by the Augusta Zadoff Award. And we worked very closely with a team of academics, of clinicians, and with an aged care provider. So when we look at our demographics for the staff that enrolled in this training course, we have, you can see the average age is actually quite high. So overall, the mean age is 32, but in the community aged care worker group, the average age was 55. And when we come to the last column here, sorry, I'm missing a column, which is the number of years working in the industry. It's the last one. The mean is nearly 10 years working in the industry. So these people that came along to the training are mature, they've been working in the industry for a number of years. We asked them right at the start to tell us how many aggressive events they'd been involved with in the last 2 months. So this graph just tells us, we gave them a range, either no aggressive events, 1 to 3, 4 to 6, or more than 6. And the number on the scale on the left, the axis is the number of people that responded. So 5 people responded that they'd had 6 or more aggressive events in the previous 2 months. And what we'll do is look at the number of events after the training. When we came to look at this training, we were trying to find something that would be different, that would actually work better, because what's been offered to date is video training or work packages that explain about behaviours of dementia. It explains about what you need to be able to do. And what we thought we'd do is provide the background the same, but then provide some experiential learning. So putting those learnings into practice in a simulation situation. So the first thing we did was create this education package, which had 6 modules, and the modules are explained there. The first one is probably the most important starting point. It's about your own story as an aged care worker. What do you bring to this situation? And then, of course, other people's stories. So the clients that you're looking after, the communication skills, verbal, non-verbal, tone of voice, volume of voice, that sort of thing. Conditions that contribute to anxiety and aggression. So not just behaviours related to dementia, but some of the background diagnoses that we were talking about, the mental health situations. The 5th module is the other things, the environment, the lighting, that sort of thing. And then finally some of the strategies. The simulation had authentic cases that were written by the staff who were working in aged care. We used professional actors, and the beauty of simulation is that you immediately put your theory into practice. You experience it. It is real. It is hard work. It is draining to be in an aggressive situation repeatedly, but the ability of simulation means that you can respond to that and learn from that and learn what to do to then manage it and avoid it escalating next time. The personalised coaching was provided by the clinicians and the experts from the aged care facility, and it was about embedding appropriate responses. So Our outcome measures, this is a very busy slide, I apologise, but we looked at the number of aggressive incidents. We also asked about the staff's self-efficacy, how they felt about those various things that are listed there. Then we asked about their self-reported change in behaviour after, and then from an organisational point of view. And what I'm going to look at is the self-efficacy. But first, the number of incidents. And so you can see that staff are still involved in some incidents. The number who are reporting none, that's probably the same 4 staff members, and there's an extra one who's had no aggressive incidents. But the number that reported more than 6 events has dropped significantly. You could speculate that that one person might not have changed their behaviour, but the trend is moving towards the left of the graph to fewer incidents. And here we have the self-efficacy. So they were asked to respond on a Likert scale. I strongly disagree, I'm neutral, or I strongly agree on a scale of 1 to 5. At line, before any training, any education, they gave us an idea, and you can see that if it's 4, they agree that they're fairly comfortable with identifying, preventing, managing, and so on. When they did the education module, their self-efficacy dropped. So this is the I now know what I don't know. When we looked at simulation, after the simulation, self-efficacy was really high, but more importantly, 6 months down the track, it stayed high and it stayed above baseline, which is really important. So their ability to be confident at work and identify and manage agitation and manage aggression is really important. I think the last bit here, which is I feel safe at work, is most important there. I'm out of time. So I'll stop. And questions later. Thank you.